Mr. President.
Senator from North Carolina.
Thank you, Mr. President. I rise today in support of the Children's Health Insurance Program, more commonly known as SCHIP. I believe that the expansion we are considering right now is long overdue. But Mr. President, I almost must express my dismay with the way that we are paying for the expansion in this program. Since 1997, the Children's Health Insurance Program has been helping low-income and disadvantaged children access medical services to treat or prevent conditions that can affect their ability to lead a healthy and productive life. If this bill is not passed, we will be jeopardizing coverage for the roughly 10 million young children that this bill helps, and Chairman Baucus and Senator Rockefeller for the inclusion of several important provisions, including providing financial incentives for states, including my home state of North Carolina, to lower the number of uninsured children by enrolling eligible children in SCHIP and Medicaid, creating an initiative within the U.S. Department of Health and Human Services charged with developing and implementing quality measures to an increase in conditions like diabetes, heart disease, high blood pressure in our children, which in turn we know leads to an increase in healthcare costs. Mr. President, this is a matter of fairness. Taxing only tobacco could cost the state of North Carolina up to 3,000 jobs and $32 million to $36 million in revenue shortfalls for our state budget. While I applaud the decision and the desire to pay for the increased spending under this bill, which I think we should be doing, I believe that singling out just one industry concentrates the impact in a few states, like North Carolina, in a way that is fundamentally unfair. In 2009 alone, the 61-cent increase that we're proposing in this bill, 61-cent increase in taxes on cigarettes adds up to $3.69 billion. And in 2010, that number increases to $7 billion from one industry alone. I am a co-sponsor of, and I would like to voice my support for my colleague Senator Jim Webb's amendment, which would reduce the proposed tax on cigarettes by 24 cents. As I have said before, Mr. President, the way in which this bill taxes only cigarettes is unfair. And I believe the proposed 61-cent increase per package is outrageous. It is my hope that this amendment represents a compromise palatable to all sides in this debate. Mr. President, I've outlined my complete support for this vital program, but also my dismay in the way in which it is funded. But this is the bill in front of us, and this is what we're being asked to vote on. When I was a state senator, I worked hard to protect and expand North Carolina's SCHIP program. And as the mother of 3 children, I know what it's like when one of your kids wakes up in the middle of the night with an earache or a stomach ache or worse. And I've seen firsthand how important this program is and the unmet need for its services. With the health and the vitality of 10 million of our nation's children on our hands, I cannot in good faith vote against this bill. Less than a month into my service here in the U.S. Senate, I'm faced with a situation in which the health of millions of my state's children are at odds with a key industry in North Carolina. But Mr. President, ultimately, I have to vote on behalf of the 10 million low-income and disadvantaged children that this bill helps. In this economy, when families are being forced to choose between paying their bills and putting food on their table, I cannot make it harder for them to keep their children healthy, safe, and cared for. I cast this vote in the affirmative as a mother and as a former budget chairman for the state of North Carolina, who knows how difficult it is for the state to close the gap in funding for this critical program when the federal government drops the ball. And it's a U.S. Senator who sees in this bill a chance for our neediest families and our most disadvantaged kids to get ahead in the face of the daunting odds that they will no doubt face in their future. Mr. President, I yield the floor.
The senator from Montana.
Mr. President, I'd just like to compliment the senator from North Carolina. She is doing what a good senator should do. First, she's defending the interests of her state. She is here representing the state of North Carolina, and she's doing an excellent job pointing out some of the problems this bill contains for constituents in her state of North Carolina. But she also is looking at a larger picture too, and that's the status of low-income children. It's a classic case that many of us face here in the Senate. It's balancing the interest and what's most important. It's not an easy decision, but I highly compliment the Senator from North Carolina for with such articulation, expressing the views of her constituents of her state, defending the interests of her state, but also recognizing that it's probably not right to deprive 10 million uninsured lower-income children of health insurance. And I compliment the senator.